Baba, as fondly called, is a 67-year-old man who presented in our clinic with symptoms of difficulty urinating for the past 3 months. He also finds out that he has to go to the bathroom more frequently than usual, especially in the night, and often feels like he can't completely empty his bladder. More so, he also notices that his urine stream is weaker than it used to be. I welcome you all to another episode of Your Health Matters. On this channel, we believe that you have the right to correct health information. This is why we bring to you health talks. And if you have been with us for a while now, you will see that we've been discussing issues that concern both males and females. But today, we are going to discuss benign prostate hypertrophy, which mostly concerns our males, our men. We cannot talk about benign prostate hypertrophy, BPH, which is usually called prostate, without actually talking about what prostate is. The prostate is a small gland in the male reproductive system that produces the fluid that makes up part of the semen. It is located just below the bladder and surrounds the urethra. Yes, your urethra is the tube through which the urine and semen pass out of the body. Now, the BPH is a non-cancerous enlargement of the prostate gland. Benign prostate hypertrophy. Benign means it is not cancerous. Prostate, it affects the prostate. And hypertrophy simply means there is an enlargement. So it's just the big grammar in English. So this BPH affects many men as they age. And in fact, according to the American Urological Association, it affects about 50% of men in their 60s and up to 90% of men in their 70s and 80s. That is significant. So as I said earlier, it is not cancer, and also it is not a precursor to cancer, meaning that if you have BPH, it doesn't mean that you will mostly or you must have cancer. No. But it is important to know that the symptoms of BPH can be similar to those of prostate cancer. And apart from age, hormonal changes can also cause BPH, and in fact, there may be a family history. It could run in the family. Now we'll talk about the symptoms. The symptoms of BPH include urinary tract symptoms. Because of the proximity of the prostate to the urethra and the bladder. So the symptoms might include frequent urination, weak urine stream, and difficulty starting or stopping urination, just as the Baba I talked to you about that presented in our clinic. Other symptoms may include blood in the urine or in the semen, might be painful ejaculation, and what we call incontinence, that is inability to control the urine from coming out. And how do we diagnose BPH? Mainly, it is diagnosed by digital rectal examination. This is kind of invasive, but it is very important for early detection of BPH. And what it entails is that your doctor will use their finger to feel the prostate through the rectum to detect if there is any lumps or hard areas that could indicate an enlargement. Another test that we use to diagnose BPH is what we call PSA. PSA simply means prostate specific antigen test, and it is a blood test that measures the level of PSA in the blood. So depending on the level, it can be an indicator that there is prostate issues. Then we can also do urine flow rate tests and some imaging studies like ultrasound or X-rays. Now, the good news is it is treatable. There is treatment for BPH. especially when you present early enough in the hospital. So there are medications that you could be given by your doctor which will help in relaxing the muscles around the prostate, so that will relieve the symptoms. And there are also some minimally invasive procedures, and ultimately you might have to undergo surgery to help with the symptoms. Now, as we know that our main focus on this channel is to ensure that these ailments are prevented. So the prevention measures for BPH are as follows. Number one is to maintain a healthy lifestyle. Eat well, exercise regularly, and make sure you are not living a sedentary lifestyle. If you are still smoking, you have to quit smoking and do not take alcohol. Also, monitor your prostate health regularly, and this will be part of the periodic health checks. These are very important. Remember that early diagnosis and treatment is important for managing benign prostate hypertrophy. And as we know that aging is the main risk factor, regular checkups with your doctor are usually recommended, especially for men over the age of 50, or even earlier if you have a family history of prostate problems. I hope you have gained one or two things from this channel today. Kindly share and comment, and also subscribe to this channel if you haven't. And if you have any topic in mind that you would like us to discuss on this channel, you can put it in the comment section below. Aminat Adeyemo is my name, and remember always that your health matters. Until the next episode, stay safe and healthy. Bye.